is an important short note as well as a essay question. So rationale of endodontics basically means the reason why you are doing endodontics. So when this question comes, you have to write a little bit of irreversible pulpitis. Why does irreversible pulpitis require RCT? So inflammation, as you know, has one of the signs of inflammation is swelling. And since the pulp is enclosed inside hard tissue like enamel and dentine and cementum, etc., it is not able to expand during the swelling stage of inflammation during pulpitis. So what happens, it in turns, the pressure starts to build up and it constricts the other blood vessels, eventually leading to necrosis. That is one reason, the inability to expand inside the pulpal chamber because of inflammation. The other reason is because tooth does not have any collateral circulation. The only blood supply to the tooth is through the apical foramen, and once that is cut off due to necrosis, there is no other way of getting collateral blood supply to the pulp. So since these are the two reasons why the pulp doesn't regenerate and heal. Instead, we have to do pulpectomy, remove the entire pulp and do a restoration, an obturation in that space. So whenever a question on rationale comes, you have to talk a little bit about inflammation, and then you have to go on about the different theories, fish theory and mountain cornfield pass theory. So I'll ask Sophia to start. She's done the PPT the way you are supposed to write an essay question. So please pay attention. Sophia, you can start.
Yes, ma'am. So, good morning to one and all. As ma'am said, today's topic is rationale of endodontics. So, today we'll be saying about how to write an essay on rationale of endodontics and what all important things we need to mention if this question is asked in the university exam. Right. So, moving on to the topic, the first is synopsis. In synopsis, you must include introduction, definition, pathogenesis of endodontic disease, roots of root canal infection, inflammation, vascular changes, fish theory, and Cronfield's mountain pass theory, and then the conclusion. So, before moving on to the introduction, by this time we all definitely know what is endodontics and what are the scopes of endodontics and why we need endodontics. So, rationale is basically the reason behind why we need endodontics. So, the word rationale means it is a fundamental reason or the logical basis. So the word endodontics is a combination of two Greek words. Endo means inside and odont means tooth. So the main rationale of endodontic therapy is based on the belief that we all know the natural teeth functions more efficiently and comfortably than the bridge, partial denture or a metal implant. So to preserve this natural teeth by doing a complete debridement of a root canal system followed by three-dimensional obturation on a hermetic seal. Right. So the next is definition of endodontics. It is the branch of dentistry that is concerned with the morphology, physiology, and the pathology of human dental pulp and the periradicular tissues. It is according to the American Association of Endodontics, 1987. And the next is pathogenesis of the endodontic disease. So the next, it is the etiology for the endodontic disease. The main etiologies are the physical agents, chemical agents, and the microbial agents. So the physical agents, it include the heat generated during the cavity preparation, the chemical agents such as dental cements with acidic pH, and microbial agents, of course, it is the microorganisms. In 1894, W.D. Miller, he was the first to identify the bacteria in the diseased pulp. Okay, so the next is roots of canal infection. So we all know the main culprit of this endodontic pathology is the microorganisms. So the microorganisms may gain access through several routes. So the main access of the microorganism is that the dental caries. So the microorganisms may gain entry to the dental pulp is by the dental caries, where it passes through the dentinal tubules and subsequently to the pulp and resulting in the necrosis. So the other routes are mechanical or the traumatic injury, gingival sulcus, periodontium, and through the bloodstream. So under normal condition, the pulpodentin complex is sterile and isolated from the oral microbiota by overlying enamel and the cementum, as ma'am said. So when the integrity of these natural layers are breached, the pulpodentin complex is exposed to the oral environment and then challenged by the microorganisms present in the caries lesions, in saliva, batting the exposed area, or in dental plaque formed onto the exposed area. So the next is various routes through which the microbes can Tamal, next slide. Next slide. So the various routes through which the microbes can travel to the dental pulp are the direct exposure of the pulp, is through the caries process, the fracture of the tooth, or the iatrogenic exposure. The next is, next slide, Tamil. Okay, the other routes are through the dentinal tubules, accessory canals, through apical foramen, and the anacrosis. So, what is this anacrosis? Anacrosis is a process by which the microorganisms are transported in the blood or the lymph to an area of inflammation and where they establish an infection. So, it is a Greek word which means refuge or also convocation. So, it is a process by which the microbes may be transported in the blood or the lymph to an area of inflammation such as tooth with pulpitis where they may establish an infection. So it is basically the attraction of the blood-borne bacteria in areas of inflammation through any defective or faulty restorations with marginal leakage, which may result in the contamination of the pulp by the bacteria. So Sculler in 1880 was one of the first to study the attraction of circulating bacteria in the areas of the tissue injury. So the next most important thing we need to mention is about the inflammation. So we all know what inflammation is, right? So the inflammation, it is a local physiologic reaction of the body to noxious stimuli or an irritant. So it is the body's way of signaling the immune system to heal and repair the damaged tissue as well as to defend itself against the foreign invaders such as the bacteria or the viruses. So it can be of traumatic, chemical or bacterial. The main objective of the inflammation is to remove or destroy the irritant and to repair the damaged tissue. The next is the symptoms of the inflammation. As you all know, it is a dollar collar tumor rubor, and which have added the fifth sign, which is the loss of function. So these are the signs of inflammation. And the next is inflammation. As we all know, it is of two types, acute and chronic. The histologic picture of these two stages show the cells in acute inflammation are predominantly polymorphonuclear neutrophils, and in chronic inflammation it is predominantly lymphocytes, plasma cells, monocytes, and the macrophages. So the next is inflammatory cells. So we need to write a few points about the inflammatory cells also. So the first inflammatory cell will be the polymorphonuclear neutrophils. It contains nucleus with three or more interconnected lobules and cytoplasm containing lysosomal and specific granules. So its main function is to phagocytose bacteria and the cellular debris. They are the first cell to migrate from the vessels, and the polymorphonuclear neutrophils along with the product of cellular lysis and nuclear debris are the principal constituents of the pus. So the next is macrophages. So these are the cells derived from the circulating monocytes, and immature monocytes in the extravascular area such as inflammation differentiate into macrophages. So its main function, they are phagocytic cells that ingest cellular debris, microorganisms, and particulate matter. They enhance the immunologic reaction by ingesting, processing, and degrading antigen before it is presented to the lymphocytes. So the next is lymphocytes. Lymphocytes appear in chronic stage of inflammatory reaction. So it is of two types, B cell lymphocyte and T cell lymphocytes. It is seen mainly in apical periodontitis. They proliferate and fuse on stimulation by cytokines and other mediators to form osteoclasts. It causes demineralization and dissolution of the organic matrix and results in the bone resorption. The next is T cell lymphocytes. So the T cell lymphocytes are responsible for cell-mediated immunity and for immunosurveillance of the human organisms. So when the T cells are stimulated by the antigens, they develop into T lymphocytes and have following manifestation. The first is memory T cells, the helper T cells, and the effector T cells. The memory T cells, which speeds the immunologic reaction in subsequent encounters with the same antigen. The helper T cells, which stimulate or suppress the development of effector T or the B cells. The effector T cells, which may produce cell-mediated immune reactions. And the next is lymphokines. It is released by the T lymphokines and activate macrophages and polymorphonuclear neutrophils. So next is the B cells. B cells has shorter lifespan than the T cells and lesser in number. When activated by the antigen, the B cells become plasmablasts, which divide to form the memory cells and the plasma cells. So the as the before slide, the memory cells speed the immunologic reactions in the subsequent encounters with the same antigens, and the plasma cells, they are large oval or round cells with eccentric nuclei containing chromatin in a car wheel form. They produce IgM, IgG, IgA, IgD, and IgE, which includes various reactions such as neutralization of the bacterial toxins by the antitoxins, coating of bacteria by antibodies to facilitate phagocytosis, and lysis of bacteria by the complement activation. So the next is eosinophil. They are found during allergic and parasitic reactions, and they are involved in phagocytosis of antigen antibody complexes and detoxification of histamine. And the next is basophils and the mast cells. They are found in hemopoietic system and the tissue. They contain granules. They are stimulated by tissue injury or antigen. They degranulate and release chemical mediators such as histamine, vasodilator, and heparin. And the next is epithelial cells. Epithelial cells, cytokines, and other mediators they stimulate the dormant cell rest of molasses. It results in the inflammatory hyperplasia. So the next is vascular changes. So there are two fundamental vascular changes include the vasodilatation and the increased capillary permeability. So first there will be Tamal, next slide. Next slide. Yeah, இதுக்கப்புறம் இருக்கிற slide. Yeah, so the first is vasodilatation of the arterioles, which causes opening of the dormant capillaries, and there will be increased blood supply to the affected area, thereby increases in intravascular pressure, blood flow, permeability of the capillaries. So the proteolytic enzymes released from the injured cells and the bacterial toxins and traumatic mechanical forces may release histamine from the mast cells. Tamil, go back to the previous slide. Yeah, and then the histamine which enhances the permeability of venules by contracting the endothelial cells and results in the formation of the intercellular gaps. The fluid leaks out from the vessels into tissues, which leads to the edema. The blood plasma, which leaks into the tissue, it contains plasma proteins such as albumin, fibrinogen, and the immunoglobulin, which is called as the inflammatory exudate, and which results in increase in tissue pressure, which results in collapse of venules, and in turn collapse of blood flow and the venous drainage. So the next will be the Hageman factor. So Hageman factor or the factor 9, which is released in the inflammatory exudate, it is activated by collagen by the damaged basement membrane of the blood vessels or the antigen antibody complexes. It reacts with prekallikrein of plasma or tissue to produce kinins, which is a vasodilator, and it also activates the fibrinolytic and the blood coagulating system. Also, plasminogen in inflammatory exudate, it is activated to the plasmin. So the immunoglobulins, it is activate, complement, and produce an effect toxin, which acts on the mast cells and release histamine. So the next, the inflammatory exudate, which produces edema and causes increased pressure on the venules to collapse, and reduce venous drainage and the blood flow. The stasis of the blood in the venules due to the increased viscosity of the blood from the loss of fluid and increased pressure resistance of the venules, which causes the leukocytes to migrate from the center of the blood vessels to the periphery. So this process of leukocytes from migrating from the center to the periphery is called margination of the leukocytes. So after margination, these leukocytes adhere to the vessel walls, and this is termed as pavimentation of the leukocytes. So the next step in the inflammatory reaction is that emigration of the leukocytes. The leukocytes are attracted by the complement to the site of inflammation and migrate through the vessel walls by an amoeboid movement, which is called as chemotaxis. So the first cell to migrate is the polymorphonuclear neutrophils, and followed by the monocytes and the lymphocytes. So the vascular responses continues with the aggregation of the RBCs in the vessels, which causes increased resistance of blood to flow, and increase in the resistance of blood flow, and the decrease in oxygen concentration, increases in the carbon dioxide concentration, and lowers the pH at the inflammatory site, which causes decreased reward of the metabolites. So therefore, the mentioned changes may spread inflammation to the adjacent tissue. This vicious cycle of the inflammation may lead to the total necrosis of the pulp. Right. So the next is increased vascular permeability. There will be loss of protein from plasma, thus the decrease in intravascular osmotic pressure, and increase in the osmotic pressure of the interstitial fluids, and increased hydrostatic pressure, which causes accumulation in the interstitial fluid, and net increase of the extravascular fluid, which causes edema, results in edema. So the next will be tissue changes following inflammation. So there are two types of tissue changes. The first one is degenerative and the proliferative. The degenerative changes in the pulp can be fibrous or the resorptive and calcific suppuration. So the proliferative would be irritants are mild and act as a stimulant. In the inflamed area, the irritant may be strong enough to produce degeneration or the destruction. The principal cells of proliferation or uh, repair are the fibroblasts. So the next is endodontic implication. So this is also an important topic which can be asked separately in the 5 mark, which is the fish theory. So Fish in 1939 described the reaction of periradicular tissues to the bacterial products, noxious products of the tissue, necrosis, and antigenic agents from the root canals. So he theorized that the zones of infection are not an infection by themselves but the reaction of the body to the infection. So what so he established an experimental foci of infection in the jaws of guinea pigs by drilling openings in the bone and packing it with the woolen fiber saturated with a broth culture of the microorganism. Broth culture is a liquid medium to grow bacteria. Okay, so he found out 4 well-defined zones of the reaction. The 4 well-defined zones of reaction are the zone of necrosis or the infection, zone of contamination, zone of irritation, and the zone of stimulation. So the first zone is zone of infection. In this zone, the infection is present in the center of the lesion, and these microorganisms are present in the center of the lesion, and it is characterized by polymorphonuclear leukocytes. So the next is zone of contamination. Around the central zone, there is an area of cellular destruction and it is characterized by a round cell infiltration. So the cellular destruction from the toxins discharged from the central zone is observed and the bone cells are dead and might undergo autolysis which result in an empty appearance of the lacunae. So the next is zone of irritation. This is characterized by macrophages, histiocytes, and osteoclasts, and small round cells, normal bone cells can also be seen, and collagen framework is digested by the phagocytic cell, that is the macrophages, while osteoclasts attack the bone tissue. So the next important is the last zone, the zone of stimulation. It is characterized by fibroblasts and the osteoblasts. At the periphery, the toxin is mild enough to be a stimulant. The response to this stimulation, collagen fibers get laid down by fibroblasts, which acts both as a wall of defense around the zone of irritation and a scaffolding on which the osteoblast can build a new bone. So, according to this concept, the periapical lesion is not an infection by itself. It's a reaction of the body to the infection. So, this theory became the basis for successful of the root canal treatment. So, Fish theorized that removal of the nidus of the infection would lead to the resolution of the infection. So nidus is a place where the bacteria multiply, where the bacteria may multiply. It is just a focus of infection. So removal of this nidus of the infection would lead to a resolution of the infection. So the next is Cronfeld's mountain pass theory. So the we all know that the metabolic byproducts of these microorganisms or toxic products of the tissue necrosis may get diffused to the periradicular tissues. So as the microorganisms enter the periradicular area, they are destroyed by the polymorphonuclear neutrophils. But if the microorganisms are highly virulent, they overpower the defensive mechanism and result in the development of periradicular lesions. So the toxic byproducts of the microorganisms and the necrotic pulp in the root canal are irritating and destructing to the periradicular tissues. So these irritants, along with the proteolytic enzymes which are released by the dead polymorphonuclear neutrophils, it results in the formation of chronic abscesses, granulomas, sclerotic bone, and then a cyst. So the Cronfeld's mountain pass theory, he explained that the granuloma does not provide a favorable environment for the survival of the bacteria. He employed the fish concept so as to explain the tissue reaction in and around the granulomatous area. So he explained reaction under 3 zones: zone A, zone B, and zone C. So zone A, next. Okay, zone A, he has compared the bacteria in the infected root canal with the invaders entrenched behind high and inaccessible mountain pass. So he has just compared the root canal system with the mountains, where the apical foramen is the mountain pass, and the invaders are the bacteria, and the plains are refers to the periapex. Okay, so the next is zone B, the exudative and the granulomatous proliferative tissue of the granuloma. It represents a mobilized army defending from the plains, which is the periapex, and periapex defending the periapex from the invaders bacteria. So when few bacteria enter the plain through the mountain pass, that is through the apical foramen, they are destroyed by the defenders. Uh, such as the polymorphonuclear neutrophils. But when the microbes are more in number or more virulent, they overpower the defensive mechanism and results in the lesions. So the next is zone C. So only complete elimination of the invaders from their mountainous entrenchment will eliminate the need for defense forces in the plains. So once this is accomplished, the defending army of the leukocytes withdraws, the local destruction created by the battle is repaired, and the environment returns to the normal pattern. So the coming on to the conclusion, the rationale of endodontic therapy relies on the fact that the non-vital pulp being avascular has no defensive mechanisms. Breakdown products from the damaged tissue diffuses into surrounding tissue leading to the periapical irritation. And endodontic therapy seals the root canal three-dimensionally, which is a hermetic seal, and prevents percolation of the toxic byproducts into the periapex. So when the root canal has been treated, Tamil, next slide. So when the root canal has been treated, the reservoir of the bacteria or the noxious products get eliminated. So when the root canal is cleaned and obturated, the destroyed periapical bone will undergo repair. The ultimate goal of endodontic treatment is either to prevent the development of endodontic lesion, or in case where it is present, to create adequate conditions for the tissue healing. So that's all. I've also written and drawn diagrams which have